So the question we just had was, how are you treating a patient who recently had a cortisone injection, meaning like a steroid shot that I'll explain in a second, who is not in pain? And when you're in school, when you're a physical therapist, sometimes, not all the time, you're looking for some certain symptoms to help you treat the patient, to know kind of how to direct your treatment. But in your case, you were saying that she just had a cortisone injection and her motion was fine, even though she came in for a shoulder problem and she was in pain a week ago or something like that, right? Anything else I missed?
No, that's pretty
So in that case, what I usually do now is just continue with what I was gonna do anyways. And I act like, well, I guess I don't act like she's in pain, but I treat her function, I guess I can say, regardless of her pain level. So let's just say, even though pain does influence function sometimes, I get it. That's, I'd have to have more time in the video to explain, but let's just say she was going this high and she had pain before the cortisone shot, and now she can go this high after the cortisone shot because the inflammation is down. I'm still gonna treat her like she can only go this high to keep it very simple. Because what we have to keep in mind is, one, what does a cortisone injection do? And two, what caused her to come here in the first place? So a cortisone injection is like any anti-inflammatory that you would take orally, like any pill like that, just injected into the specific site. Again, I'm keeping it simple. And that brings the inflammation process of the body down, and usually sometimes that helps patients feel better and move better. Not all the time, but sometimes it does. But my question is for her, if she was coming in, well, what caused that to be there in the first place? Because it's still there. Her problem is still there that caused that inflammation in the first place. So once that cortisone shot wears down, she might go back to where she was before. So what caused this is usually some type of inhibition or reciprocal inhibition of the muscles and nervous system connection, especially, well, it doesn't even matter if it's chronic or acute. So let's just say she is now going this high, but really she should be going this high. Nothing to me would change functionally. Even though the pain is better, her function is still limited in some capacity. Does that make sense
Yeah.
so far? Any questions so far? No? Another thing that I've ran into, I guess, in the past, and I'll still run into in the future, is when I don't really find anything. Let's just say she's going this high now, and now she's going this far out, and she can reach behind her back, and she can reach behind her head. And sometimes I usually find this with athletes too, when they could seemingly do a lot. Now my